Okay, good morning, everybody, and welcome to Redefining Care Management, the shift from manual to automated. My name is Lenny Heffern. I'm a clinical solution engineer here at Arcadia, and I am joined with...
My name is Kate Brandon. I'm a Director of Product Management here at Arcadia.
Okay, so as we move on, a couple of objectives we want to cover here in our booth talk is really discussing the automation capabilities to really streamline those workflows for our care managers and care management teams. We're going to review a case study of automation in care management with one of our clients, and then we'll share some of the results of that case study. But just a few things about care management. The one thing that care managers really need, they don't have enough of, is time. And so we really need to be able to optimize that time. And one way to do that is by using automation within a workflow, automating those manual tasks, so to speak. So a little bit about Arcadia clients. We have about 5,200 users that are leveraging our capabilities today. About 210,000 total tasks created per month, and 97% of those being closed. Our clients are seeing over 200,000 goals being completed by using automation within their daily workflow. Certainly, we're accessing quite a few charts. You can see there 38,000 a day being opened up. We're supporting around 350 care management programs among our clients. And daily, each one of those tasks, 72% of those daily tasks that are being assigned out by those care managers are being closed. So what that's really telling us is it's driving patient engagement, whether it's through a med adherence program, it's the assessments, all of the different tasks those members have, those are being closed out to provide that better care so that you can really scale out your care management program. Because if you, by automating these different tasks, having a lot of this placed on your list for you, it gives you a lot more touch points with those managers or with your patients rather than having to go back and do a lot of data mining just to identify who you need to reach out to in any given day. So if we look at automation, how would this work? What does it look like? So if we look at this through the lens of a transitions of care program, through an ADT feed, we can monitor that. We can identify a member's been discharged from a facility. Immediately, the automation engine kicks in, runs through a list of rules to identify that member to say, this is a person that we need to get on a list of a care manager to continue that care. Once that happens, it will assign a care manager to that case automatically. It can also panel manage. So if you've got multiple care managers, one manager's maxed out, it's say 50 members, it can move on down the line to the next care manager to help out with that panel management. We can also automate the communication process. So sending out an SMS text message to that particular member to say, hey, we understand you've just been released from the hospital. We're going to have a care manager reach out to you in the next 24, 48 hours. We can also assign the appropriate assessment for that particular member. Once that's done, the care manager logs in. They'll see the list of identified members for them. They can do that outreach, start the assessment that's been assigned. And as they do those assessments, we can automate the care plan. So by minimizing the number of clicks that member has to take to build a care plan, as the member is answering the questions in that assessment, the care plan is being built in the background for them so that when they do complete that assessment, all the care manager has to do is accept those different goals and interventions for that particular member. Once you have that care plan in place, now we can start to automate the different tasks and the outreach and the touch points that you have based on your particular care management program. And then as we continue on, you execute that care plan, whether it's a 30, 60, 90-day plan, and then you disenroll the patient accordingly. So just a few highlights from what our clients are seeing by leveraging this automation capability with the Arcadia platform. 41.5% reduction in their COPD patients in ED visits. That came from one of our clients up in the Northeast. Less provider burnout. So we're seeing an 18% reduction in the treat and release ED visits, 125% in daily patient care activities, as well as a 20% decrease in readmissions, saving a sizable sum of money for our clients, a little over $1.8 million. So with that, I'm going to give it over to Kate, and she's going to discuss a little bit about this case study that we did with one of our clients.
So what does this look like in practice? Let's look at an example here of a customer who ran a chronic care management program and all of the steps that we were able to automate through that program. So we started out with stratifying patients into cohorts. What they looked at were patients in the commercial and Medicare lines of business who had a set of chronic conditions. We looked at patients who had multiple emergency department visits or inpatient visits to automatically stratify them into this program. And what's really important here is that we were able to set up rules that automatically brought patients into this program and identified them for care management without anyone having to lift a finger and go search for them themselves. So once we stratify these patients into a program automatically, we're able to assign them to certain care managers based on provider attribution. So we could have 5 care managers, each working with 10 practices, and a patient who was attributed to a certain provider in one of those practices would go to the right care manager who had that relationship with their PCP. So that's really important for closer patient relationships with both the care manager and the PCP for better patient outcomes. So again, we're automating this throughout the process. The care manager does not have to go search for the patient. They wake up in the morning, they log in, here's a new patient identified for a program and ready for outreach. From here, we moved on to the initial assessment for the chronic care program. So the initial assessment, once again, automated onto the care team member's calendar. We know that the assessment is due within 10 days, so we schedule it 10 days out and highlight for them that there's an opportunity to work with a patient here. And then from here, we go through the follow-ups throughout the program. We can automate a couple pieces here. One of those pieces is AI identification of follow-up assessments that might be necessary. So where are there certain conditions that are identified for the patient throughout the assessment that we know are specific to the patient that we need to follow up on? We can highlight those continuous assessments as we go through the larger assessment, and then automate follow-ups throughout the time of the program to know that a patient needs a touch point every couple weeks, and we can put those on the calendar again so that that manual work to identify when a patient has to be reached, how often they have to be talked to, doesn't have to be done. It's just available and ready to go as the patient progresses through the program. And then for this example, this was a 90-day program. So we know after 90 days, the patient needs to be evaluated for graduation from the program. You'll note the average length of the program was 96 days here. We are not going to automatically discharge the patient for the program or close them out, but we can again put that reminder in front of the care manager to say, the patient has been enrolled for 90 days, it's time to evaluate for program graduation. So what's really important here is that all of these steps can be automated. All of these pieces can be improved by automation so that the user, the care manager, doesn't have to spend time doing administrative tasks that we can handle for them. These are the outcomes that we saw from this program. We saw a 38.3% decrease in emergency department visits per 1,000 patients, a 12.1% decrease in total cost of care, a 27.6% decrease in acute admissions, and then a 6.76% increase in PCP visits. So overall, patients who graduated from this program successfully, aided by automation, had significant improvements in cost, decrease in admissions and ED visits, and a better relationship with their PCP and improved rates in going to see their PCP for better care over time. So through all this, we're able to improve patient outcomes and aid care managers to do their jobs more effectively through automation.